Good afternoon, Lorenz Philip. Let's begin the warm-up session. What is the dignity of being a nurse?
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
What are the skills I need to be a nurse?
To be a nurse, you need a combination of both hard skills and soft skills. Hard skills are those that are learned through training, education, or certification. Soft skills are habits or traits that enable you to work well with others. Hard skills can be acquired through formal education, such as a diploma, associate degree, or bachelor's degree in nursing, and certification or licensure exams. Soft skills include interpersonal and communication skills that are vital for building rapport and trust with patients and colleagues, and can be developed through experience, feedback, reflection, and self-improvement. However, depending on the specialty, setting, and role, one may need additional or specific skills to excel in the nursing career.
How would you deliver bad news to a patient or their family members?
It is a tough but inevitable part of the job, and I believe I have learned to navigate it effectively. I understand how hard it is to watch a loved one feel uncomfortable, so I always try to demonstrate empathy when speaking to patients' family members. I calmly explain the patient's condition and the next steps we need to take, giving them time to process that information and ask as many questions as they need. Even though the news must be upsetting, I knew I needed to be honest about the situation to manage their expectations appropriately. I would never want to give families false hope about the outcome. However, I also emphasized our medical team's commitment to providing him with the best care and treatment options available.
Describe your ability to handle high-pressure situations.
I have always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I am also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
Your preparation time is over. Please start your OET speaking roleplay.
Hello, Mihiraa. Good afternoon. Please come in and have a seat. Good to see you today. Well, could you please confirm the reason for your visit today?
Thank you, Lorenz. Sure, I'm here for a dressing change, and nurse, I have been experiencing some mild pain. The dressing feels a bit tight, and there's a dull ache in my hand.
I'm sorry to hear that you're feeling uncomfortable. To help me understand what's happening, Mihiraa, could you tell me a little more about this pain you're feeling?
The pain started a couple of days ago and has just been a mild ache.
How would you describe the intensity of it on a scale of 1 to 10, with 10 being the worst pain you could imagine?
I'd say about a 2 out of 10.
I'd also like to know if you've noticed any other symptoms around the wound, such as any redness, swelling, unusual discharge, or if you've been feeling feverish.
I haven't seen any extra redness or swelling, and there's no discharge. I haven't had a temperature either.
Thank you for clarifying that, Mihiraa. It sounds like you've been very observant. Now, I want to find out how you've been managing things at home.
I've been changing the dressing once a day, just using the same gauze and tape that was given to me. I've been taking some paracetamol when the ache gets a little worse, and it helps a bit, but the pain doesn't completely go away.
Thank you for sharing all those details. It's good to know you've been following the instructions so well. Now, let's talk about what we're going to do here today. My first step will be to gently remove the old dressing and carefully assess the wound. I'll be checking its size and depth and looking for any early signs of infection. After that, I will clean it thoroughly and apply a fresh, appropriate dressing. I can also offer you some pain relief medication here if you need it. Before we proceed, do you have any questions or concerns about these steps?
No, that all sounds straightforward. I'm just looking forward to having a clean dressing on.
That's great. And Mihiraa, to help with your recovery once you leave, I have some advice for you on home pain management and wound care. For the pain, you'll find it helpful to keep the wounded area elevated, especially when you're resting, as this can help reduce swelling and discomfort. Also, getting plenty of rest is essential for your body to heal. For wound care, it's very important to keep the wound dry, so take care when you're bathing. Continue to change the dressing regularly as we've discussed, and remember to keep checking for those signs of infection we mentioned earlier, like increasing redness, swelling, or any unusual discharge.
That all makes sense. Keep it elevated and dry.
Exactly. Lastly, I just want to go over a few other important discharge instructions before we start. Mihiraa, please make sure you attend any follow-up appointments that are scheduled, as this allows us to monitor your healing process. If you notice any concerns with your wound, such as the pain worsening significantly or a sign of infection, please report it to us straight away. It's also a good idea to avoid activities that might strain the wound, like heavy lifting, for a while. Now that we've discussed everything, are you happy for me to begin the dressing change?
Yes, I am. Thank you.
You're welcome. Here's a summary of everything we've discussed today, Mihiraa, to make sure you're clear on our plan and the advice for your hand wound. Today, you came in because you needed a dressing change for your hand, and you mentioned experiencing some mild, dull pain that started a couple of days ago, rating it about a 2 or 3 out of 10. You also confirmed that you haven't noticed any concerning signs like new redness, swelling, discharge, or a fever, which is good to hear. You've been diligently changing your dressing daily with gauze and tape, and taking paracetamol, which helps a little but doesn't completely take the pain away. Our plan here today involves me carefully removing your old dressing, then thoroughly assessing the wound size and depth, and checking for any signs of infection. After that, we'll clean the wound well and put on a fresh, clean dressing for you. We can also provide you with some pain relief while you're here if you feel you need it. Looking ahead to when you're back home, it's really helpful to keep the wounded area elevated, as this can reduce swelling and ease the pain. Getting plenty of rest will also aid your healing. For your wound care, remember to keep it dry, especially when you're bathing, perhaps by covering it with a waterproof dressing. Continue changing the dressing regularly, and it's very important to keep a close eye on the wound for any signs of infection, such as increasing redness, more pain, swelling, warmth, or any unusual discharge. If you notice any of these, please contact us right away. Finally, Remember to attend any scheduled follow-up appointments, report any concerns early, and try to avoid any activities that might put a strain on your wound while it heals. I appreciate your consent to go ahead with the dressing change, and we'll get that done for you now.